Doctors of Reddit, where are some of your anti-vax parent stories? I had a kid come in that was super sick, 3 years old and in septic shock. He had the flu and another compounded viral infection, or maybe pertussis. Heart rate was close to 200, respiratory rate in the 50s, blood pressure in the 70s. Kid was so fucking dry that we could barely get IVs into him, and I almost had to drill an IO. We dumped a ton of fluids into him, started him on vasopressors, and transferred him to the local children's hospital. I had asked the mom if he was vaccinated, and she said, no, vaccines have really bad side effects, they'll make you sick. I explained to her that not getting the vaccines had made her kid 10 times sicker than he ever would have been from any mild vaccine reaction. She told me I was a fucking moron and that I obviously have no clue what I'm talking, and that's the reason her kid was getting transferred. She also told me that recommending she vaccinate her kids was racist. Addict. Didn't expect this to blow up, so some clarifications and answers to common questions. CPS was called and, once again, I was told there would be no investigation. This is their usual response. My wording about it, possibly being pertussis, was clearly confusing and misleading. I fucked up how I phrase it. Pertussis is indeed bacterial. Made the edit to make it more clear. I ran an NP student, not an MD. This was like 2 years ago. I don't remember all the specifics. I didn't follow up the other hospital about how the kid did. I try not to follow up on patients to keep things compartmentalized. I have the opposite of what you're expecting to hear, I assume. As a medical student, I went to see a young child in the outpatient clinic before the attending. The child was due for vaccines, and I talked to the parents about getting them on that day. The parents said they had reservations about them, so I talked to them about their reservations. We talked about all of the things they had read on the internet, and walked through each point one by one. One of the benefits of being the medical student is that you have nothing but time. I explain how vaccines are made and how they work. They don't have the mercury preservative they once did. Some vaccines are live but attenuated and others are immunogenic sequences bound to a protein. And why we get so many so early. That's when you're almost likely to be affected by these diseases. They were concerned about the effects of so many vaccines at once. This is a common concern, but we challenge your system less with a vaccine than you see walking around in the world every day, and about them making the child sick, not possible with anything but a live vaccine, and that's why those are attenuated. They're such a small dose that a non-immunocompromised individual should have no problem with them, even though you might feel a little sick because we active your immune system, and that's how you feel when it happens. The whole discussion took probably half an hour, and then they decided to go forward with the vaccines. As it turns out, most people are just scared, and who can blame them? With all of the misinformation in the world, it's easy to see how parents get to that point. But they also are human, and when you sit and talk to them like the people that they are, intelligent and able to understand your points, they respond in a positive way. It's one of the moments in medical school that I reflect on frequently, especially where things are tough and I feel like being impatient with people. When I was a medical student, I had a 5-year-old patient who looked and acted like a 2-year-old. Failure to thrive. His mother was super weird. She shaved the sides of his head, somehow like a marine cut, but kept his back hair long. She refused to vaccinate him or even feed him certain foods. Her sister and her husband were trying to get custody of the child, because his mother was weird and didn't take care of them properly. I suspect she was paranoid. She would literally fight and call you names if you attempt to suggest to put the child on a proper hospital diet. She wanted to inspect the food first and make sure he eats only certain things. Long story short, the attending called in county and they took the child away from her. Edit. Thank you for those who pointed out that the haircut is called the mullet cut. Another point to add, he was admitted for a fracture which was really worrisome in a kid that age. Unfortunately, I don't know what happened to the kid after they took him away. but is definitely better off. I'll tell a different kind of story. I am an ear eye doc and recently had this interaction with a patient. Adult male comes in with fever. He comes back positive for the flu. Me, you have the flu. I will write you a prescription for Tamiflu. Patient, doesn't that cause autism? This guy couldn't even remember that it was vaccines that reportedly cause autism. And he couldn't remember that it wasn't a flu vaccine. And of course he is wrong about vaccines causing autism. And he is a grown-ass adult that thinks he will suddenly be autistic. We had a 14-year-old female come in for abdominal pain one time. She weighed 80 pounds, looked sickly. Her mother refused to let her eat anything but a handful of things. Nothing with very much protein at all. She literally had a binder full of articles about how horrible vaccines are, all the bad things they put in foods these days, etc. She had completely brainwashed this kid, so the kid believed it too. Her labs showed malnutrition, her teeth were horrible, just a sad case all around. When I was a med student, I had a parent who wanted to do a delayed vaccination schedule. Basically, it means that you get all the same vaccinations, but you pointlessly and foolishly do it over a long time period. The mom had read a book promoting this practice that was unfortunately read by an MD. My pediatric attending had zero chill. Is that the book written by Dr. Blank? Yes. Well, then you should know that I was in the same medical school class as Dr. Blank, but I got much better scores than he did. I had a mother bring her child to see me as a new patient. When I saw that he wasn't vaccinated, I asked my nurse why not, and she told me that the mother had a religious exemption. When I entered the room, I asked the mother what the religious exemption was, and she said, "Oh, well, when he was a baby, he had a rash from the hepatitis B vaccine." I kindly told her that I couldn't take care of her child because he was not only a risk to my staff, myself, but also to the other patients in my office. She went off on me and ranted about how she can't not believe that every doctor's office that she calls refuses to treat her son because he isn't vaccinated, and that the only doctor in the county that will see him can't see him for almost 2 months. I kindly stopped her and said, "If I was one of the few that refused to treat your child, I would understand your frustration. But don't you think there's a message that not a single doctor in the entire county, save for one doctor who did some really questionable practices, think essential oils and stuff, will treat your kid? That maybe there's a valid reason behind it?" Yeah, she definitely wasn't happy and left. Med school student here. I was getting my hair cut and I was talking to the barber about how more people should get the new meningitis B vaccine, since I know a person who got meningitis B and almost died. The desk lady went off about how vaccines are dangerous, and pretty much every single anti-vax talking point. I explained the actual facts behind vaccines and said that I'm studying medicine. I think I might know what I'm talking about, and then she went off about professors not knowing what they are talking about, and that they just teach whatever they are told to teach, so that we can all be brainwashed into supporting the big pharmaceutical companies, and that my proof were all fabricated by them. Nearly qualified pharmacist here, so obligatory not a doctor. Our pharmacy offers travel vaccines for people going away to countries with a high likelihood of severe tropical disease. Star parenting goes to the parents who got themselves vaccinated for rabies, but not their 2 primary school age, elementary, for non-Brits, children. In medical school I saw a kiddo whose parents refused vaccines, and so they were given the vaccine refusal form to sign. This form essentially said that the parents understood that refusing vaccines was against medical advice, that their kiddo could get sick from all the preventable diseases, and that they wouldn't hold the doctor/practice liable for any complications that the kiddo might get from said preventable diseases. This mom pulled out a Sharpie and blacked out the part about the doctor not being held liable. The parents thought that we'd be cool with them just changing the form just for them, and they wanted the doctor to be held liable for their moronic choice. Of course, this didn't work and they were told to sign the form or they would be discharged from the practice and have to find another. They refused to sign and were told to leave after given a list of other pediatricians in the area.